Let me just begin by thanking Clean Water Action, Conservation Law Foundation, and the citizens organization, public employees that are working on this issue nationally. It is indeed an extremely important issue from a public health perspective. One of the things that was mentioned with the remarks that we heard is that most of the information that was shown to us in the slides actually came from Aries' own proposal. So it's important, and I think you can still get it online. You go to the city's webpage and look back a few months, you'll be able to see one of the slides that actually shows the stack. And it states that, yes, they will have a small amount of PFAS that would be emitted. It's right in their own proposal that they're going to emit PFAS from the stack of the proposed plan. I am very proud of what Clean Air Taunton has done since its inception. They've gone out and reached out to the leading environmental agencies. These agencies that have state offices that are the best nationally on protecting our environment and our health. So I want to say thank you to all of you for the diligent work that you continue to do on behalf of protecting the public health here in the city of Taunton. I also want to thank the local elected officials that maybe not at the very beginning, but through this process have learned what we've learned tonight and have come on board to be against this project because they want to protect the public health of their constituents. And I look out here tonight and I see Phil Duart sitting right in front of me, was out front on this issue from the very beginning. You see Barry Sanders here, taking a very strong position on this. I see Councilor McCall, who is with us and has understood where we are now on this issue. And you all heard Estelle Borges's, comments. We're up to 4 votes there. And there are at least 2 others that are not here tonight, but have publicly said that they are opposed to the facility. So that's 6 votes, not 5. In January. 6 votes in January for a vote that would be against this proposal if everybody continues to do and say what they have said throughout the electoral process. And it's up to all of us to make sure that that does happen. The people that I mentioned that are here tonight and the ones that are not, they have integrity. They thought long and hard before they made their public statements on this issue. I've spoken to each and every one of them, and they understand the complexity of what's going on here and what's in the balance. And that's our collective public health. Now, I'm going to say something I haven't told too many people. And tomorrow, I will find out, with the 5th year of testing, whether or not I am what one would call a cancer survivor or not. Because earlier this month, I went in and had my 5th MRI to check on my kidneys, because I had a small cancerous tumor on my left kidney that I found out about 5 years ago. And because of the wonderful medical services that we have here in the Commonwealth and the tremendous medical care that we have in metropolitan Boston, I went in to have an ablation where they go in through your back and they heat it up and froze the blood flow to that tumor. And so far, I've been a very, very, very lucky person. It was found early enough, and hopefully tomorrow, at this time, I'll be smiling away. But still, always thinking about the consequences that could still remain in my body and where it may show up next. That's what we're talking about here. That's one of the reasons why I'm so passionate about this issue. People's lives are in the balance here. And we can stop something bad from happening. The New Jersey plant that you heard, that's not up and running. I mean, think about it. For 2 years, they've been trying to get data and they can't even get the plant working correctly. Do we really want to be the guinea pigs for that technology going forward? When there are other things that the leading scientists have looked at and have shown us that we can do anaerobic digestion. It's not the perfect alternative, but it will save the city some money in terms of shipping out biosolids to other places, paying a very high tipping fee to do so. And that's what's driving all of this, by the way, right? Is the amount of money the city has to pay to ship out the biosolids. And so obviously, if you're paying a lot of money and somebody's coming along and telling you, well, we got to wait for you to save some money, well, you want to listen, right? And so the city listened, but they haven't listened to all the technological alternatives and how we could work regionally with other municipalities to cite a type of entity that would be able to store the PFAS waste from the biosolids that are left after an anaerobic digestion technology conclusion in landfill, in a safe and lined landfill, these remaining parts of the anaerobic digestion policies, and in some cases, using other anaerobic digestion technologies, if you can house them in similar places. For example, those of you that are aware of where the Stop and Shop facility is in Freetown, Massachusetts. Freetown actually has an anaerobic digestion facility for Stop and Shop. All the old food waste at Stop and Shop gets shipped over to the anaerobic digestion facility, where they use the food waste to actually develop power to help run some of the facilities that they're connected to. Hospitals, schools, other places in our society that could actually operate off of anaerobic digestion technology in the very hard to decarbonize sectors of our society, like shipping and some airline back fuel systems, and the very hard to decarbonize major trucking. There are opportunities to use anaerobic digestion technology to utilize the fuel sources and put it in there that actually decrease methane gas, which is really, really dangerous, and the other greenhouse gases, to actually have ourselves embrace a much better, cleaner energy future for all of us. So I want to conclude by just telling you about a bill that is before us at the state level. And you heard the lack of evidence. We don't have the evidence. It's been far too long now. We've waited almost a little over about 2 years for the evidence to arrive. No evidence has arrived. Only promises that are out there. I can tell you, I'm going to be speaking in Raleigh, North Carolina on December 9th at a national meeting as chair of the Council of State Governments National Organization on PFAS. Yes. Legislatures from throughout the country have picked this as one of the top issues that we need to deal with. And we're going to be listening to the EPA, which will be presenting to us what they're doing right now relative to their public rulemaking and the rules that are out now for comment. And we're going to be looking at that. And by the way, I think the water number, and you guys would know better than I, but the water number, I think, is somewhere around 4 parts per trillion. 4 parts per trillion. As was stated, they don't have a number to even suggest for air quality standards. So the bill that I proposed, along with Carol, who had to leave, Carol Doherty, and the other members of the legislative delegation from the region, seeks to stop any procurement by municipalities of facilities that would generate PFAS waste emissions until and unless a standard for safe public health has been promulgated, regulated, and adopted by EPA and DEP. Both. Has to be adopted by both. That's what the law says. Until we can have a regulated standard that says it's safe at a particular level, whatever the level happens to be, then you can't procure these services if the services will emit harmful, toxic chemicals that go into the air that can impact somebody with kidney cancer or testicular cancer, or, you know, impact somebody's baby that is on the way, or impact a pregnant woman. I mean, there's just, I mean, the list goes on and on and on in terms of what we know we have evidence for. We have evidence for the bad things that take place to people. We have that evidence in terms of not protecting our public health. That should be enough for us to act and wait for the right technology to come forward. There are other technologies we can use. We can do composting. There's a whole range of things that we could do to make things better than what it is today. And there's a lot of testing that's going on with technology to get rid of PFAS. And when a company actually does that, and I hope someday that will happen. This is not it, by the way. So when it actually does happen, you'll have these same organizations standing up applauding the outcome of that, and it will be in the national headlines. It won't just be in the national headlines, it'll be in the international headlines. The company won't have to worry about marketing itself because everybody will want the technology. It's not here, it's not now, and hopefully with the right number of votes on the city council, it won't happen here ever. So the bill is before the Committee on State Administration and Regulatory Oversight. I have a commitment from the two chairmen. We had it reported out favorably in the last session. It's going to be reported out favorably in this session, but then we need to get it over the goal line. And that's where I need everybody's help. The Senate Chair of Ways and Means is right in Fall River, Massachusetts. There's a few people in this room that have connections to Fall River and New Bedford because of the work that you have done on the project in New Bedford that you helped, you know, kill for now. We're going to need to get the calls going and the letters going as soon as that bill gets reported to Ways and Means so that we can get it on the floor of the Senate. I believe if we get it on the floor of the Senate, we'll have the overwhelming majority of votes, even though industry has written in to legislators saying how dangerous this bill would be if it were to pass. How dangerous this bill would be if it were to pass. A bill that simply says, until EPA and DEP actually promulgate and put into place public health standards, you shall not procure these types of technologies. What's so dangerous about that? It's just saying, we're not even saying no forever. We're saying, wait until we know it's safe. That's what the bill says. So I would ask you for your help and support on that initiative. And I just want to conclude by saying again, thank you to Clean Air Taunton. I was on there, the Zoom call last night, and I see the same faces all the time. And they need community help as well. So any members that are here for the first time, or maybe a few times, but you haven't really got involved with the group, I'd ask you to do so. Because you can make a difference. And maybe just save a life or two along the way, maybe that life might be your own. So please get involved and try to make a difference. And make sure you continue to talk to the counselors that had the courage early on to stand up on this issue. And those that have come along and understood what the complexities of this were and what it means to public health at the end of the day. And I hope we get the research done and the proper motions that need to be made so that they'll be able to be upheld constitutionally as we go forward. So I thank you again for your leadership, and let me know what I can be doing in the future to continue to work on this issue, because we need to win it, and we need to make sure that this in particular doesn't happen. And the second piece of legislation that's up there is there's an omnibus PFAS bill that's being looked at as well. And so we're looking at getting PFAS out of the upstream part of our system. And we're trying to do that as well. I believe we will pass a bill on PFAS this session. That means after January through July, I believe that will take place. There was a commission that was formed, and we were involved with that. And I'm glad that we have some good recommendations, so much so that Maine, New York, New Jersey, the mayor of Newark was one of the people that eventually came out and, helped kill the proposal there. And, so, stick together and we'll eventually help to change things for the better. Thank you very much.